All right, welcome everyone. Today, we get to play detective. We're going to solve a clinical mystery, piecing together clues to crack a diagnosis. You ready? Let's dive in. Okay, right out of the gate, here's our central puzzle. We've got 4 possibilities, but only one of them is the real deal. So take a quick look. Which one feels right to you? Go ahead, make a guess. Because we're about to break down exactly why one of these is the right answer and why the others are just red herrings. But hold on, before we can start pointing fingers and making a diagnosis, we've got to understand the machinery, right? I mean, you can't figure out what's wrong with an engine if you don't know how it works in the first place. So let's pop the hood on the human body for a second. So what are we even talking about when we say anemia? Well, you can think of it as a massive supply chain crisis happening inside your body. The big problem is you're running critically low on healthy red blood cells, and those are the delivery trucks that carry oxygen everywhere it needs to go. This shortage, that's the heart of the problem we're investigating. And this really breaks it down for us. First, you've got your red blood cells. Think of them as this huge fleet of oxygen taxis, right? But then with anemia, you've got a major taxi shortage. So what's the result? Well, your body's tissues are basically left stranded, waiting for an oxygen delivery that's just not coming. This is what we call a critical oxygen deficit. Now, here's where it gets interesting. This internal oxygen crisis, it doesn't just happen quietly. The body starts screaming for help, sending out all these distress signals. And these signals, well, they're the physical symptoms we can actually see and measure. These are the clues that are going to lead us right to our diagnosis. And here is our lineup of key clues. When the body is starved for oxygen, it presents a pretty classic set of signs. We're talking pale skin, feeling out of breath, a heart that's racing, and just this overwhelming sense of fatigue. These are the telltale signs we're on the hunt for. Okay, clue number 1, pallor. You know that healthy rosy color in your skin? That actually comes from the hemoglobin in your red blood cells. So it makes sense, right? When you don't have enough of those red blood cells, that color just fades. You're left looking pale, almost washed out. It's a huge visual tip-off that something's not right on the inside. Clue number 2 is that feeling of being short of breath. Think about it. Your brain is like a super sensitive alarm system. The second it detects that oxygen levels are dropping, it slams the panic button, and it tells your lungs, hey, we need more air now. So you start breathing faster, trying to pull in more oxygen, even if you're not doing anything strenuous at all. All right, so we've got our 2 main pieces of evidence locked in, pallor and shortness of breath. But any good detective knows you have to rule out the other suspects to make your case airtight. So let's go through these imposters one by one and see why they just don't fit. Let's look at imposter number 1. Option A. It says flushed skin and a slow heart rate. Well, that's literally the opposite of what we'd expect. Anemia makes you pale, not flushed. And your heart, it doesn't slow down, it speeds up. It's working overtime, frantically trying to pump what little oxygen-rich blood it has around the body. So yeah, option A is definitely out. Now, for option C, hematemesis and nosebleeds. Now, this is a bit tricky. Can massive bleeding cause anemia? Absolutely. But active bleeding itself isn't a direct symptom of the anemia. It's more like the cause of the problem, not the effect. These symptoms point to something else entirely, maybe a clotting issue. So C is not our answer. And finally, option D mentions jaundice, that yellowish tint to the skin. This clue sends us down a completely wrong path. Jaundice has pretty much nothing to do with your blood's oxygen levels. It's a classic textbook sign of liver problems. So we're talking about a totally different organ system failing here. D is a definite no. So after looking at all the evidence, ruling out the imposters, the picture becomes crystal clear. The findings that are most consistent with severe anemia are, without a doubt, B, pallor and shortness of breath. If you picked B at the very beginning, congratulations. Your clinical instincts are spot on. And this really boils down to a key clinical takeaway. You can think of it as a rule of thumb. When you see that combination, pale skin, shortness of breath, and a fast heart rate, especially with fatigue or dizziness, you should think anemia until proven otherwise. It's just such a powerful diagnostic pattern. So we've just seen how a specific cluster of clues can unlock a pretty complex medical mystery. It really makes you think, doesn't it? What other big problems out there, in medicine, in science, in anything, are solved not by finding one single smoking gun, but by recognizing a distinct pattern of signs? That's really the art of it all. Thanks so much for putting on your detective hats with me today.